I'm here. I'm Darlene Kindiak, and I'm here to just give you a little bit of a background of myself. I have 30 years in a career that's been 15 being in healthcare management, working in healthcare, managing inpatient, outpatient programs, and then following restructuring, doing some teaching at McMaster, doing some partnerships with McMaster and Waterloo, and then doing this latter part of my career in the legal system. So first working with legal aid and then Department of Justice, as well as doing some tribunal work on consent and capacity panel. So I'm here now as an educator and with the paralegal license, and this Department of Justice project is a truly a wonderful initiative that's gone through 3 phases, and so it's now been refunded again. And I'm pleased to say that this presentation has received LSO, Law Society Accreditation Professionalism of EDI credits. So that's truly great. I'd like to make sure that you're aware of my co-panelists, Angie Pham, who's a social work and community development, who's here to assist, as well as Carrie Sinkowski, lawyer and community development, working with Brantford. Angie is with Waterloo, and then with Carrie, and both of them are here to assist myself in managing the chat. And just to say that through this presentation, individuals are most welcome to ask questions throughout, and to do that through the chat. And then Carrie and Angie will be comfortable to interrupt me so that you can address questions throughout the presentation. But in addition, at the very end, we'll stop the recording. And then as well, if people have other questions that they can ask at the end, that will also be available. So as we begin, I just wanted to ensure that that everyone is here and understanding that that this is a place that individuals can feel comfortable, again, to interrupt and to share. And thank you for that. And so I'd like to begin today's presentation by the land acknowledgement that we are meeting on Aboriginal land that has been shaped and strengthened by contributions of the Métis, Inuit, and the Indigenous people. I will speak about Hamilton because that's where I'm currently located, but please reflect upon your own territory. And that the city of Hamilton is situated on the traditional territories of Erie, Neutral, Huron-Wendat, and Haudenosaunee and Mississaugas. This land is covered by the Dish with One Spoon Covenant Belt, which was an agreement between the Haudenosaunee and others to share and care for the resources of the Great Lakes. We are grateful to the generations of people who are stewards of the land, which we now call home. And as we work towards reconciliation, may we learn to address the harms of the past, but also the harms which continue when racism and biases are permeated. And may we all work towards integrating calls to action, healing, and the betterment for all of us. So just to give a nice overview of the project, the focus is awareness, so that everyone becomes aware of the workplace sexual harassment issues, that we're able to provide education. And now we actually have an advice line with the number at the bottom of the screen there for individuals that have any kind of queries about anything that they might experience in the workplace. And that is available for this 3rd phase of this project, which will be taking us for the next 2 years until March 31st, 2027. So in terms of an agenda, we have here the overview of what is a healthy workplace. And that's how I want to start this presentation, with understanding that piece of it, getting into some legal definitions, getting into some statistics of what the data is showing, and then looking at somewhat the dynamics that are at play in regards to sexual harassment and why it becomes so prevalent in these workplaces. And then, of course, some resources. And so I'm going to begin with just a picture. And this next picture I selected this picture because it attracted me, and it attracted me because of it reflects engagement, it reflects collegiality, and it reflects positive energy and individuals working together. And that's what we want. That's what we want in our workplaces. And we want the openness and dialogue. So why are there so many challenges? And so that's where we'll now then go into a little bit about definitions. So to define what is a workplace, in essence, we're looking at any land, premise, location that's where a worker works. And whether it's your full-time, part-time, volunteer, student, any kind of category of a workplace, you are covered under the Occupational Health and Safety Act, as that you need to be protected by your organization, that harassment should not be existing. So that's something to be aware about. And the next slide, which is also a continuation of definitions. So while the world of work has seen some changes related to the pandemic, we know that workplace also can include the home office. But in addition, it also includes professional training venues, when individuals are engaging and their colleagues, related to work at any location. That's an extension of the workplace, wherever that might be. And whether it's also virtual communication, one-to-one communication in person, all of those aspects, again, it's all covered under workplace, under the Occupational Health and Safety Act. So I'm going to take you now in terms of this document that's actually, it's actually part of the CMHA piece, and it actually is this document, just a second here. It's actually a document that was prepared in conjunction with U of T and Dalla Lana School of Public Health in approximately 2011. And it first acknowledges that the workplace environment is a key determinant of health, and that the way the work is carried out, that there can be stress-related emotional conditions which cause psychological injury to individuals. And to help facilitate a high functioning, respectful, productive, healthy workplace, there needs to be protection of workers and reduction of risk factors. So we're going to get back to this, but I thought it was really important to also share that in terms of the determinants of health, how key that and central that is in terms of the work environment, and then understanding how the context of how, when it's not healthy, how that could lead to so many other vulnerable factors. So if we then go into the next slide, what does the law say? So the law does say that employees have the right to be free from discrimination and harassment at work, and employers have the obligation to provide the environment to ensure that it's free from harassment, and and that they have a responsibility to respond and act when harassment does occur. And that is so key. And in terms of also this legal responsibility, it means that that the employer needs to ensure that there's protection from not only harassment, but also violence, also bullying. And across Canada, there is a major push through legislative amendments to make employers more accountable for fostering a mentally safe work environment. And this is becoming a greater and greater issue. In terms of other definitions that I'd like to share about, the next one involves the Canadian Labour Code. And so this is, again, on the federal level. And in terms of the definition, conduct, gesture, and it's defined as that's likely to cause offense or humiliation to an employee, or it might on reasonable grounds be perceived by that employee as placing a condition of a sexual nature on that employment or an opportunity for training or promotion. So the definition under the labor code is a little bit more legalistic per se in perception elements. And then if we go on to the next definition, which is the next under the under the provincial law, occupational health and safety, it actually includes two key elements. One is that sexual harassment is the engaging in a course of vexatious conduct against a worker because of sex orientation, gender identity, where the course of comment or conduct is known or ought reasonably to be known as unwelcome. And it's the last two lines where the conduct is known or ought reasonably to be known, is that, well, you'll see a lot of, if there's rulings on matters, that's where they often go back to, is to those particular comments. And then our next slide, which is a continuation of the definition. Oh. The next slide.
Sorry, Darlene, it's on that slide, I think. What is sexual harassment? Second slide.
Oh, I see. Thank you. It looks so similar. Thank you. So making a sexual solicitation or advance where the person making it is in a position to confer a grant or deny a benefit or advancement to the worker, and the persons are ought reasonably to know the solicitation, again, is unwelcome. So those are the parameters. That's the context of how sexual harassment is defined under the Occupational Health and Safety Act, which governs in Ontario all of our workplaces. So thanks, Carrie, for that. So if we carry on into some of the research pieces, and so I want to bring some highlights to the next documents. And the first one is, so what's the connection between our work environment and sexual harassment? And there's some really interesting documents that have been referred upon. And so what is the research showing? So this first document actually this was published in 2018, but the data comes from information from 2016. And actually it was identified in this report that some of this information actually was the impetus that actually facilitated the SHU funding that came from this report. And so it was across 10 provinces. It was during a 12-month period. It was during that period of August to December, so 4 months, but the sample size really quite significant of 19,000. The original sample size, and then of course the response being 50%, and then 9,000 being the sample size. So what does that information show, which is on the next one, is that the indicators are showing that poor quality environment is really a huge factor in terms of allowing for a vulnerable place for harassment to occur. So what they're finding is that fewer opportunities to provide input, less support from their managers, unmanageable workloads, limited choice in the sequencing of tasks, more competition amongst colleagues, more frequent conflicts with managers and supervisors, fewer good friends at work. Those were characteristics that were indicators of a poor quality work environment. And it's from that information that goes then to the next slide. And that it's showing that in terms of harassment that reports SHU, which is specific to sexual harassment, that it's targeted by clients and customers, targeted by colleagues, personal characteristics associated with individuals who are also vulnerable. So that would be the young and individuals that are single. And that in that particular finding, that age and marital status are proxies for less seniority at work and poor job quality, factors which might then lead to increased likelihood of SHU. So again, interesting enough, some of the background and the context of sort of the environments that end up having that kind of experience in the workplace. And so it's showing, again, where there's some real vulnerable factors. And interesting enough, having good friends at work is definitely a factor, what they noted for women when it comes to workplace harassment. That if you have better support systems, it seems that that factor could be less. But interesting enough, friendships in the workplace play a role. Another study, which is the next slide. This actually then comes from the Me Too movement. And this one also statistics that were gathered in 2018. And this, the highlights of this report, in essence, I took the next piece, which is what are the 5 industries where SHU is most prevalent? And the answer is on the next slide. So what you'll see here is that healthcare and the federal government is at a higher end, and the other locations include trade, service, and education work environments. Another thing that came out of this this report, which is the Angus Reid report, is who are the most common SHU perpetrators? Customers, clients of the services, highest. Second being colleagues, and then lastly is management. The next study that I wanted to bring your attention to is a study that comes out of University of Western. And this report was dated 2022, but the data is from 2020 to 2021, so exactly during our COVID times. And it comes from a study that's called Respect at Work. And the center of Western, it's called the Center for Research and Education on Violence Against Women and Children. And they were the initiators of this study, and semi-structured interviews. And there was 4,800 participants, so a huge sample. And some of the highlights of this report goes on to the next piece. The behaviors and practices that are most common in this research showed that sexual conversations being the highest at the so that would be like teasing conversations, and then next would be unwanted touching, invasion of the space. So like when people are just like a little bit too close. And so when you see here the 56, the 60, and the 61%, those are the highest in terms of percentages. The next grouping which is behaviors include um, sharing of sexual materials, actual stalking, and then the sexual materials. So the 42, 36, 29, 25, 23, they included things like unwanted looks, gestures, comments, not man enough, not woman enough, unwelcome communication. So yeah, so that would be in the mid range, and then at the bottom you've got the sexual assault, which would be the lowest at 4%. Other things include asking of sexual favors, um, insults related to orientation, gender expression. So those were actually on the lowest end. So that's what this data found in this particular study. The next slide also then goes into the behaviors and practices, verbal intimidation being the highest. And that would be, so you can see here at 72%, 71%, 68%, verbal intimidation, rumors, negative comments, persistent criticism of work performance, undermined, sabotage, that is the highest. The mid-range types of harassment in the categories of 50, 48, 45, 32, and 23%. So that mid piece, physical and property, unreasonable deadlines, tasks, excluded from work-related social activities. Those would be the kind of behaviors. So it's not the sexual harassment, but different types of harassment. They also sort of poked in on that piece. And at the bottom end, which is the lowest amount, it's when you've got like the 20, the 19, and the 16%, the display of hateful, discriminatory material, physical assault, no injury, serious injury. So that would be on the low end. So interesting findings from this particular research. And then when we go into the next slide, the risk factors. So very, very interesting. So what they're finding is that the highest risk factors for sexual harassment: serving alcohol, the exchange, handling of money, valuables or prescriptions, as well as interactions with the public. So that is on the very, very high end. Other factors that are affecting risk include the times of day, night, and year, the level of isolation of a person, whether or not they're working in a remote geographical area, small numbers, or in situations where assistance is not as easily available. So those are other risk factors that can definitely increase the amount of harassment that actually is occurring. Interesting enough as well, online harassment is also identified. It's on the low end, 32, 28, and 26%, but it actually also is still prevalent. So definitely things to think about and know about. This next slide, I always, feel it's really important to be aware that the risk factor that affected one particular individual actually led to her death. And this was Teresa Vince, and she was 25 years working at Sears Canada in a small town of Chatham, Ontario. And the interesting thing about this story is that when you look at the previous slide of vulnerable factors, and when you read about Teresa's story and that this harassment occurred with her for years and years and years before her death, the Sears store would have been like a small store in comparison to, some of the other larger, in the bigger urban centers. So it probably would have been, just and she was working in the accounting department. So, and she would have been isolated, and she would have been sort of like tucked away. That's how individuals are. Um, and so yes, I always, make sure that on the day of mourning, when they talk about people who died in the workplace, specific to this project, to always remember Teresa Vance. Um, so yes, so the next one is about, you know, I wanted to share this video, this slide, because it was actually a post that I actually had done. So in the phase 1 of the project, so this is back July 2021, and this was a post that was done by my some peers, and it just said, sexual harassment can cause poison in the workplace. That's all it said, and this is back in 2021, and in my circle of communication, it just went viral. And then it just really caught my attention. So this is now back, 4 years ago, and you just go, what is this, what is this saying about our workplace? And that, and it just used the word, poison, that sort of just causes you to think, like, what is becoming so poisonous? So I wanted to, introduce that because again, it sort of like relates to what is happening in these workplaces that are leading to this harassment. So this next slide is just about, somebody starts a new job, and here we are. We're coming in and everyone's shaking their hand and we're saying, wow, like, we're so glad to be here. So what is happening that's leading to this harassment? So because everybody comes in with, just with all sparkles, and it's like, what, how do we deal with things? So I wanted to share that, as a visual, and then the next slide is also a visual because um, it has to do with boundaries. A lot has to do with boundaries and understanding. So, how do we get into these discussions? And um, so so from here, I wanted to share this next slide, which has to do with introducing this person, who is Kimberly Crenshaw, a professor of law from University of Columbia. And back in 1989, she actually introduced this term called intersectionality. And the definition is when two or more oppressions overlap in the experiences of an individual or group, creating interconnection barriers, complex forms of discrimination. And it refers to the intersectional lens that can assist to understand the multi-layered and intersecting interplay between oppression and privilege. And this legal term has become so helpful, so helpful in understanding the dynamics of what is happening in the workplace. So when you think about, what a person experiences, which is then the next slide about what does it mean to, in terms of intersectionality. And this slide introduces us and in a very concrete way, every person comes in with their own background, their own experience of who they are and what they bring forward. But then they also experience their own based upon if they've had any issues related to gender identity or sexuality or age or refugee status or elements that lead them into different statuses in our workplace. And it is what it is. Every one of us is all unique. And the next slide is another way of that I found, because we're coming in with our different elements of our, of our occupations, our marital status, our class, our gender, our own mental health, the way we look, our culture, our, physical, our language, all of those pieces. That's all who we are. And it's that intersection of those elements that are unique to us, that when we do experience something, that our reactions become, again, specific to our own context. And so this next slide, which leads to the information about, back to psychology 101, the flight or fight response, and how if we do experience something that's related to a touching or something that, somebody, says something that's a little bit awkward, how we then respond is now even broader than just the fight or flight, but they've incorporated the elements of freeze and fawn, so that you end up becoming either also numb, and you might have some difficulty knowing how to respond, or that you become so overwhelmed that you just end up um, becoming very pleasing in those moments. And those are all these four different response uh, mechanisms are now, again, part of the context of based upon what we've learned from intersectionality, that it just is unique to our situation, and then how we respond is again unique, and it can be so different to everybody. So I just wanted to introduce all of those factors in terms of, how um, complex it all can be, and that people's interpretations of sharing things or discussing things in the workplace might be just, very simple, but yet the context of who we are and what we bring might make them a little bit more sensitive, and this sort of this literature helps us understand why that is why it's also different. So how do we clarify, our next slide, which is like, how do we clarify our boundaries when it comes to sexual harassment? And so at this point, I wanted to introduce a video, and the video is called, so yes, before we put on the video, you know, it's important to know what is consent, and how do you know when somebody is consenting to sex, and if it's mutual or not. And so there's this next video, it's just under 3 minutes, and Angie will help us get that started. There's no sound to Angie.
My apologies. I'll start it over. Can you hear it okay?
No.
Oh. Try one more time. Sorry. Good.
No.
That's very odd. Sorry. Try one more thing. Okay. Should work this time. Sorry about that.
If you're still struggling with consent, just imagine instead of initiating sex, you're making them a cup of tea. You say, "Hey, would you like a cup of tea?" And they go, "Oh my God, fuck yes, I would fucking love a cup of tea, thank you." Then you know they want a cup of tea. If you say, "Hey, would you like a cup of tea?" And they're like, I'm not really sure. Then you could make them a cup of tea, or not, but be aware they might not drink it. And if they don't drink it, then, and this is the important part, don't make them drink it. Just because you made it doesn't mean you are entitled to watch them drink it. And if they say no thank you, then don't make them tea. At all. Just don't make them tea. Don't make them drink tea. Don't get annoyed at them for not wanting tea. They just don't want tea, okay? They might say, yes, please. That's kind of you. And then when the tea arrives, they actually don't want the tea at all. Sure, that's kind of annoying as you've gone to all the effort of making the tea, but they remain under no obligation to drink the tea. They did want tea, now they don't. Some people change their mind in the time that it takes to boil the kettle, brew the tea, and add the milk. And it's okay for people to change their mind. And you are still not entitled to watch them drink it. And if they're unconscious, don't make them tea. Unconscious people don't want tea. And they can't answer the question, do you want tea? Because they're unconscious. Okay, maybe they were conscious when you asked them if they wanted tea. And they said yes. But in the time it took you to boil the kettle, brew the tea, and add the milk, they are now unconscious. You should just put the tea down. Make sure the unconscious person is safe. And this is the important part again. Don't make them drink the tea. They said yes then, sure, but unconscious people don't want tea. If someone said yes to tea, started drinking it, and then passed out before they'd finished it, don't keep on pouring it down their throat. Take the tea away. Make sure they're safe, because unconscious people don't want tea. Trust me on this. If someone said yes to tea around your house last Saturday, that doesn't mean they want you to make them tea all the time. They don't want you to come around to their place unexpectedly and make them tea and force them to drink it going, but you wanted tea last week. Or to wake up to find you pouring tea down their throat going, but you wanted tea last night. But if you can understand how completely ludicrous it is to force people to have tea when they don't want tea, and you're able to understand when people don't want tea, then how hard is it to understand it when it comes to sex? Whether it's tea or sex, consent is everything. And on that note, I'm going to go make myself a cup of tea.
Thank you, Angie. This next slide talks about witnessing, and that the data shows that actually the majority of incidents that do happen in the workplace do include witnesses. And that's really important to know, that we're living in these environments that whether or not we're experiencing, but we could also be watching. And so the next slide talks about what it means to have, to be a bystander. And what bystander means is that when it occurs, when the presence of others hinders an individual from intervening. And it's, why do we sort of, stop ourselves from getting involved? And of course, there's all kinds of reasons. Somebody else will, help out, or I don't want to make it a big deal. They really, don't know really why I should get involved, or I don't want to draw any kind of attention to anything. And it all, those are those are the things that sort of happen, while we're in these moments. And it's very, very common. And so what we want to be able to sort of help individuals get comfortable with is, rather than be a bystander, is to move, as identified in the next slide, which is becoming an upstander. And that that you're somehow able to sort of find a way to get into the situation where you're either distracting, you're checking in on the person, you're sort of connecting with others. So you're sort of, again, finding a way to sort of like de-escalate. And this next slide, actually, I wanted to bring to your attention is, it's called the 5 Ds of bystander intervention. And the 5 Ds referring to distraction, delegate, document, delay, direct. And there's a really great little video. So I just wanted to make that under the guidance of Shape, that it was like a 3-minute video. So on your own time, just make reference to that. And you might want to just go and just review that, just Google that. But just gives you some really great ideas, and that there is a role that you can assist, so that when you're a bystander, that you can actually become more of an upstander. And of course, distraction is the easiest, greatest way of dealing with things, but they go into, levels of level as assisting. And as we move on to the next one about reporting, why are individuals not reporting? If we know that it would be helpful to report. And it all goes back to uncertainty, whether you've crossed a line, about consequences, about fallout, believing that the perpetrator really didn't mean to cause discomfort. And those are very real. And those are very real reasons why people pause and just go, I'm not really sure, I should get involved, not get involved. And this next slide also even gives even more reasons about you're worried about repercussions. You're sort of, it really wasn't so bad of a deal. The perpetrator really well. It's just sort of an innocent kind of flirtation, that kind of stuff. And, again, more reasons why people just, in those moments, just sort of pause. And so the next slide talks about why it's important to report. And while there's a duty to report unsafe work conditions, because it actually, by letting it go, it does create opportunity for this, awkward kind of behavior to permeate, and they allow it to get repeated. And so finding a way to report would be helpful. In terms of your obligation to management. And again, it's then you at least know it's in somebody else's hands. And if the superiors don't know about it, then nobody can address it, in the future. So again, the context of why reporting in some way is, a really great step in terms of the workplace. And we go back to, obligations of everybody. So we have obligations of the employer. They're required to have policies to respond to deal with complaints. They're required to provide training to staff on policies and programs. There must be an investigation after a complaint. And there needs to be assurance for privacy of participants if there is an investigation of a complaint. And those are, all set as standard responsibilities in the workplace. So what's really interesting about this third phase of this SHU project, which is the next slide, is that it now includes a component of an 800 number, 833 number. And so if there's any kind of queries of any sort, of any nature, that line is available. And even if people are uncertain about whether or not it should be, just to be able to talk to somebody that's, not attached, but you're just explaining. So this is now part of the expanded SHU project for the next 2 years. So I wanted to then close off by bringing your attention to a human rights report, which reminds us about the principles of respect, dignity, and that those phrases are embedded in the Commission's report about the need that we need to have those elements in all aspects of settings, including the workplace. And that our workplace, going back to our nice photo, our goal is to attain and sustain a healthy workplace. That's what we all want. That's the goal, so that everyone, it's in those healthy workplaces that people are the most productive, people are able to maximize their potential, and you want to be able to sustain that. I mean, that's when businesses thrive, services thrive, people thrive, and that's what we all want. And in terms of literature and options, in terms of the next, we have workplace safety prevention measures. Um, those are standardized documents that come from public health agencies. And that also is, again, the foundation of the healthy workplace and creating that proper psychosocial work environment. And then I just wanted to close off with a poem that I actually wrote, back in the first phase of the project, which is the hope for our workplace, that we all contribute to the making of a positive work environment, whether at home, virtual, or an identified work location, that we all ensure our workplace promotes productive, resourceful, creative energy that helps facilitate each worker to function at their optimal level and potential, and that we all carry the strength and courage to confront and redirect unnecessary comments, actions, and behaviors, thereby helping to teach when such actions may be unwelcome. So that's what we want. And the last slide is just some resources that are available through some of the reports that I've spoken about. And another key piece of information is with the logo behind me, which is sexual harassment, the advice and prevention, which is now part of this initiative. And there's, so if you even just Google the shape piece, there's lots of ongoing posts and information that will be helpful over the next 2 years. So that's it. We could stop the recording, Angie.